You just had surgery and you're having constipation? Here's what really helps. Hi, I'm Jade, nurse practitioner for over 20 years and also the owner of Jade Aesthetics and Wellness. So one of the most common complaints after surgery isn't pain. It's constipation, believe it or not. And if you've had a tummy tuck, a BBL, breast surgery, or a mummy makeover, you know exactly what I'm talking about. And if you don't, listen in. Constipation after surgery happens for several reasons. Pain medications can slow down your intestines. Anesthesia can temporarily affect bowel function. Reduced movement and activity can make things worse. Not drinking enough fluids after surgery can contribute to hard stools. One of the most commonly recommended over-the-counter options for constipation is Miralax. Miralax is over-the-counter. You can get it anywhere, any pharmacy, Amazon, Walmart, Publix. Miralax, what it does is it works by pulling water into the colon, helping to soften stool and making the stool easier to pass. A typical adult dose is 17 grams, which equates to about 1 capful. So you'll pour 1 capful, and then you're gonna need 8 ounces of water or any fluid that you like. Why I like this is because this particular bottle is exactly 8 ounces. So you would open this, take this capsule, and pour it in. But obviously, you should follow your surgeon's instructions or the product label. But the product label says, if you get this particular one, the product label states what I just said. Remember also, hydration is just as important. Most adults recovering from surgery should aim for approximately 34 to 100 ounces of water daily. So for example, this is an Awala cup. It's 34 ounces. So you should be drinking at least 2 bottles of this per day. Here's my Stanley. This is also 34 ounces. So you should aim to drink at least 2 of these daily. And I definitely wouldn't recommend that you drink tap water after surgery. So I prefer alkaline water. This is Publix brand. But any bottled water or any water that is that's been purified can definitely do the trick. Other things may include walking several times a day is tolerated, eating a fiber-rich diet and foods when approved by your surgeon, drinking warm fluids in the morning like hot tea or coffee, staying consistent with your bowel regimen instead of waiting until you're severely constipated. If you hadn't had a bowel movement within several days after surgery, or you're having severe abdominal pain, nausea, vomiting, significant bloating, please contact your surgeon immediately. I'm Jade with Jade Aesthetics and Wellness Recovery. We're just not about healing after surgery. We're about supporting your whole body. Follow for more post-op tips, and thanks for watching. Bye, Jade Babes.